Hi, I'm Jill Shepard Davenport. I'm very aware that I am the last thing in between you and lunch and you and the free massage and acupuncture that's out there. So I'll try to hold your attention. Quick story. I'm a nutritionist, a certified nutrition specialist with background in public policy, in nutritional biochemistry, and in food as medicine. And one of the places that I work is here in DC at the Veterans Hospital in the Integrative Health and Wellness Program. It's a fantastic program. I also provide meditation and health coaching there. And it was about 6 weeks into a transitioning to Whole Foods group, and a veteran walks into the group room and sits down and stands up and sits down and stands up and sits down and stands up and says, "Notice anything?" This woman, when she started out with us, she had to use a ton of grit and the arms on her chair to slowly, very slowly lower herself down because she was in that much pain. Here we are 6 weeks in, and she says that her pain is so tremendously reduced. And I kept up with her, and after she finished the program, she and her doctor made the decision together to take her off her pain medications because they determined that she didn't need them anymore. So what happened? What did she do? We're going to talk today about food as medicine. Maybe. Okay. So nutrition is core to health, but not yet core to health care. We know that chronic disease, chronic pain, chronic inflammation is common and costly. And the CDC tells us that of the 3 main contributors to these chronic problems, poor nutrition is one of them here in this wealthy nation. So to talk about why and how whole foods can be medicine, quick science story, biochemistry of pain, NF-kappa B, 3 steps. The first step is a trigger. It could be an injury, a traumatic brain injury. It could be an infection, imbalanced gut bacteria. It can be PTSD. We know that trauma translates into the physical in part through this pathway. It can also be through food. We know that inflammatory foods, especially those that contain lots and lots of sugar, contributes to inflammation through this pathway. So the first thing is a trigger. Then the second thing for producing inflammation is activation. So in our cells, 2 proteins. These 2 specific proteins, they bind together and they form this protein complex called NF-kappa B. Then NF-kappa B makes its way into the nucleus of a cell and talks to the DNA and says, start producing all of these myriad of inflammatory compounds. That's trigger, activation, and then inflammation. These inflammatory compounds, they can go into the connective tissue. There are other inflammatory compounds that go right into our spinal cord in the disc area in the lower back. There are other inflammatory compounds that actually increase our receptiveness or our ability to feel pain in the first place. So we need something, anything, to downregulate this painful, inflammatory NF-kappa B. Enter food as medicine. So we know that opioids work by blocking the receptors for pain in the brain and the spinal cord, the central nervous system. Anti-inflammatory foods, what they do is that they prevent pain from being generated and being transmitted in the first place. Anti-inflammatory foods prevent pain from being generated and transmitted in the first place. So here's some of our superstars. Hopefully you like some of these. And the deal with anti-inflammatory foods is that they actually reduce the production of compounds that allow us to experience pain in the first place. So that's on the one hand. On the other hand, when we eat anti-inflammatory foods, we're crowding out all the other foods that bring up our levels of inflammation. So let's zero in on a couple of these compounds. These are coming in your bento box lunch. You'll be getting some ginger, some sweet potato, some kale, some cashew, and lots of other really good stuff. In ginger, there's an antioxidant called gingerol. In sweet potato, there's this storage protein. It's called sporamin. In kale, there are antioxidants, flavonoids, and carotenoids. In cashew, there's this fatty acid called anacardic acid. And there are others in your meal. You'll be getting omega fatty acids in your salmon. You'll be getting another kind of omega fatty acid in your olive oil. All of these, we have the research literature. All of these compounds in the meal that you're about to eat help reduce NF-kappa B. They literally send the message to the cells to say, stop, proteins, stop binding to each other. We've got this. We don't need you to keep doing this over and over and over to stoke the fire of inflammation and pain. Cost-effective pain strategy right here, eat the rainbow. And all this means is eat every color of the rainbow in fruits and vegetables every day. And the reason that this works is that the compounds in these foods, they help provide the color in these foods. 3 policy priorities. 1, expand Medicaid and Medicare reimbursement to cover nutrition for pain. Expand it for qualified nutrition professionals like certified nutrition specialists and registered dietitians. 2nd, education. Let's expand SNAP-Ed funding. Let's use the USDA dietary guidelines to educate everyone about the power of food as medicine. What did the veteran that I mentioned at the beginning do? She used food as medicine to help herself. She also used meditation and other wonderful modalities that you've heard about today. And then thirdly, let's use all of our existing programs. Let's use SNAP. Let's use WIC. Let's use farmers market vouchers. Let's use Double Up Food Bucks. And let's expand funding so that providers can prescribe food as medicine, and so that people can afford to get it. So we have the framework, and now one of our great opportunities is to utilize this existing framework to prioritize food as medicine. Some references. I'm here if you have any questions. Judy Stone is also here, and she's a wonderful resource on nutrition policy. She's with the Board for the Certification of Nutrition Specialists. And in case you haven't heard, this board is the nationally recognized body for providing certification to advanced degree nutrition professionals. Thank you.